And the question, of course, how do you think the president did last night? We've got reaction from both sides with Congressman Phil Rowe of Tennessee and Democratic Congressman John Yarmuth from Kentucky. Congressman Yarmuth, let me start with you because as we're sitting here on this Thursday, where are the nose counts? I've seen as of late last night that there were not enough votes to pass, I'm not even sure which measure, but a measure out of the House right now.
Oh, I think that's not true. I think there will be enough votes to pass a bill with a strong public option. The polls immediately following the president's speech confirmed what I had found in my town hall meetings and with my constituents, that once you take the time to clarify the issue for the American people, explain what's in it for them, how it will benefit everybody, particularly the people who have coverage, they're overwhelmingly supportive. And I think he made the case last night, and I think it's going to be very, very easy to get our 218 votes.
Congressman Yarmuth, you have said that you're willing to risk your political career on health care. That's a very strong statement. Why do you feel so strongly about health care?
I came here to change the health care system. Beginning in 2006 when I started campaigning, I mean, that's what people have asked me to do time after time. There isn't even a close second over these three years as to what people have asked me to do. And that's to put security and stability into their health care lives. I have people all the time who have gone bankrupt, who have lost their homes, who are trying to struggle to decide whether to pay for medications or their mortgage payment or food. This is a desperate situation for an awful lot of Americans, including ones who have insurance, because they don't have adequate insurance. And that's what I came to do. So I'm very, very pleased if I wear it as a badge of courage if I vote for this and somehow lose my job. But I'm not going to, because the overwhelming people in my district are for this reform.
Okay, well, Congressman Rowe, you've asked the president that you want to go over the bill line by line with him. Have you gotten a response from the president on your request?
No, we haven't yet. We've sent a second letter, an inquiry, and we probably will inquire again. And I agree with John. I came here to help reform health care, one of the major issues of this country. The problem is I don't want the government doing it. I think that individuals can. I think there's some common ground. And last night, the president gave what I thought was a partisan speech. And again, I think staking out this strong public option, I find it interesting that it's okay to have a public option for the 60% of people or 80% of people who get their health care through their own insurance or whatever, but it's not, you can't have a public option, you can't have a private competitor to Medicare. So in one case, it's okay, in the other case, it's not. And I believe that health care decisions should be made between patients and their families and doctors.
But Congressman,
I believe that there are...
Congressman, let me ask you both. This is Alan Murray. And I want to ask both congressmen this question because, as you said, there is a lot of common ground. Clearly, when you're talking about things like insurance reform, making sure people aren't denied coverage because of pre-existing conditions, those are things that both parties agree on. Why is it that you can't get to the common ground? I have to say, I covered Washington since maybe 1979, 1980. That scene last night was one of the most unpleasant things that I remember watching in those 30 years. It was so partisan on both sides. Congressman Rowe, you talked about the president being partisan, but that's the first time I've ever heard somebody stand up in the middle of a speech to the both combined houses and say, "You lie," to the president of the United States. How has this thing become so nasty and partisan, and why is the common ground so hard to get to?
You know, that's a great question. I think the common ground ought to be easy to get to. And that's why I'd like to go sit down with the president. In all sincerity, I want to do this, along with some of my colleagues. We have not been consulted at all. I would have thought as a doctor with 30-plus years experience that you take advantage of that. Take someone who's had experience with TennCare. We've talked about that here on this network many times before, and the experiences that we've had. I'd like to go over and do that. Where we agree, let's agree, and then where we disagree, let's see if we can work out a common ground.
Congressman Yarmuth, are you going to be happy if this is done completely by Democrats on a partisan basis?
Well, I would surely love to have Republican support for it, but it doesn't trouble me that it's going to be done with only Democrats, because Republicans, I'm not necessarily saying Phil, but Republicans consistently have said their primary mission is to stop reform. They don't want to give the Democrats this victory, even though our victory is not for Democrats, it's for the American people. But you've seen Jim DeMint say this, you've seen the Frank Luntz memo time after time after time. It's stop the plan. And I've yet to hear, maybe Phil will prove me wrong here, I have yet to hear Republicans say, if we do this, if you're willing to give us this, that we'll vote for the plan. Mike Pence, I heard the other day, he would not do it, even though it was continually trying to pin him down. They won't vote for anything that we propose.
But you know what I saw last night was some in your party standing up and holding plans that they had indeed worked on. They have come to the table with suggestions, and they feel rebuffed by the administration.
Yeah, absolutely. I mean, we've dropped a bill about 5 weeks ago before we went on recess, H.R. 3400, an excellent bill that has a lot of the same things the president talked about last night. I would disagree with John on this. We need a bipartisan bill. Health care, the years I've practiced it, is not a Democrat or Republican or independent issue. It's a people issue. And the people have to buy into it. And I will tell you, in my district, they are overwhelmingly against this government option and the government intrusion into their own private lives. They're worried about it. People are very concerned, and they very well should be. If you read, as I've done, that entire bill more than once, it is an incredibly complicated and complex bill.
I agree with that.
It needs to be much simpler and easier for the American people to understand.
We're going to leave it.
But you know, only 12. Okay,
ahead,
12
last word,
Republicans voted for 12 Republicans voted for Medicare in 1965. I think the country embraces that now.
All right, we're going to leave it there. Congressman Yarmuth, thank you very much for appearing on Fox Business. Great talk
Thanks
there.
for having us.
Yeah,
Thanks
It's also
for
very
having us.
interesting, the last comment he made about Medicare. I heard this last night, too, about the fact